Right. Hello there. Hi. Welcome to today's live lesson. Lovely to see you here. I hope you're well. Today, it's an interesting lesson. It's a special one. It's all about hospitals. We'll be talking about doctors, nurses, hospitals. We'll be looking at vocabulary, some idioms, a bit of listening, a quiz, all sorts. And all of that is happening right after this.
It's time. Yo, yeah, go get your coffee. It's time to join the Key Speaking Academy. It's time for a live lesson, fun games and idioms. Go get your tea, go get your coffee. It's time to join the Key Speaking Academy. It's time for a live lesson, fun games and idioms.
Fun games and idioms. All of that is coming indeed. Well, let's see who is here. Hello, teacher. I miss you. Ramadan. I am Ramadan from Sudan. Lovely to see you here. Very, very nice. I'm just going to change the size a little bit. Great. Amy's choice. I'm glad you've chosen me today, right? Great. Bipin is here. Hello from Niloufar. Lovely to see you here. Bella. Hi, you. Hi, everyone. Chinello as well. Lovely to see you here. Excellent. Who else have we got? We've got Irina. Great. Lovely to see you, Irina. Hope you are well and well and happy and doing lots of learning and practice. We've got Nora, Rababa, Eva. Lovely to see you here as well. Chinello, has the class started? Well, you're not waiting now. Hopefully you're ready to go. Hello, Yuen. Good to see you. Artyom, long time no see, but happy to join again. Me too. Happy to see you here. Sarah, lovely to see you. We've got lots of people here. Lovely to see from all over the world. We've got people from Vietnam, from the Philippines. We've got from India. Lovely to see all of you. Auntie Babu, lovely to see you. Thank you, everybody, for joining. We've got an interesting... I'm going so fast. Slow down. We've got, I hope, an interesting lesson today. As I mentioned, we're talking about the topic of hospitals. Quite widely, we'll be talking about different aspects of hospitals, the role of doctors, the role of nurses, the role of hospitals in our society, kind of bigger questions. So you can see kind of part 1, part 2 and part 3 questions if you're preparing for IELTS. Even if you're not, I think this will be an interesting session for you. So if you're new here, welcome. This is our live lesson. I do the live lessons the first Thursday of every month. Today I have something special for you because the live lessons can be useful, but they are quite long, right? It's about an hour and a half to 2 hours. I'm going to share something with you today which will help you practice after the live lessons in a short period of time to really boost your vocabulary. I'm going to tell you more about that a little bit later. If you're new here, get your tea, get your coffee. I've got my Cambridge cup. It's all wearing off. It's such an old cup. I didn't go to Cambridge. Well, I went to Cambridge, but not to the university. I went to the shop just to buy the cup. Yes, I actually went to Sheffield University and Edinburgh University for my master's. But today, what I'm talking about, what we're going to do today, let me kind of introduce the lesson to you, what we're going to do, so you've got a clear idea of the activities we'll be doing. Whoops, come over here. If you're a fan of the Muppets, here they are in action in the hospital. That's today's topic. We're going to be looking at some vocabulary first, focusing on the meaning, the form, how to use it. Then we'll move on. We'll be doing a listening bingo. It's a listening activity and done in kind of a fun way. I'll show you that, see if we can improve your listening. And also after that, we'll be looking at some idioms. For example, to be in the blank of it. I wonder what that idiom is and what does it mean? We will be finding out shortly. Also, got an interview with a nurse talking about their job, their role, and what they do. So that'll be interesting later. Again, more listening and vocabulary practice. And then finally, we finish up with a game of Kahoot to review all of the vocabulary. So essentially, that's it. That's what's going to take us through today's lesson, more or less about an hour and a half to 2 hours. Great. Ekran has just joined from Bangladesh. So has Christine all the way. We have a bank holiday. How lucky. That's nice. Good for you. Hi, Tham. Lovely to see you all the way from Syria. Abdi Fatah. Yes, that was Mr. Bean as the doctor. Mukhtar Ali from Somalia. Lovely to see you here, sir. Very, very nice. And we have a chemistry teacher from Uzbekistan. Excellent. Now, to warm up, to begin, I have a question. Does anyone of you work in a hospital? If you do, type in the chat. Just tell us your job if you work in a hospital, right? So does anyone work in a hospital? And if so, tell us what your job is. And as you're doing that, let's have a listen to this. Let's see. Elvira, I didn't know you're a nurse. That's interesting. Great. Anybody else? Nora is a doctor. I didn't know that. Interesting. Any others? Anyone else work in a hospital? Shakila is a doctor. Okay. Fan is a nurse and a doctor. CJ is a nurse. Aha, interesting. April, medical professional. Nice. I like that very much. Medical professional. Lovely. Good. LKC says no, but my friend is working as a nurse who needs to work from dawn till dusk. A lot of medical operations are involved, I assume. I assume so, yes. Omer is an orthopedic surgeon. Interesting. Great. Abdi Fatah, yes, as an accountant in the hospital, right? It's interesting. We think of hospitals as nurses and doctors, but there are hundreds of other people, support staff. Well, not only support staff, but who make the operation work, right? Landau, a pharmacist. Interesting. Great. Keha was working as a doctor and a teacher. Amaryllis, I didn't know you were a doctor, right? In intensive care. Interesting. Haitham, just for fun, right? Zeki, I've worked as a doctor in a hospital for 35 years. Interesting. Nam is a dentist. Right. Brilliant. Really interesting. And a doctor from Myanmar over here. We've got a biomedical technician, Nagia, public health practitioner. Great, interesting. Before teaching, I worked as a biologist in a hospital. Daniela, you see, the things we learn, very, very interesting. Okay. Alexander says, I've passed an orthopedic surgery. That means you're the patient, right, Alexander? I assume. My sister wants to be a doctor. And that's interesting, right? Because it's like if you think about IELTS speaking, and sometimes you don't know or you don't have an answer about you, but you can talk about somebody else, right? Yes, my sister wants to be a doctor. At least you're on topic, so to speak. Very, very interesting. I'm sure there's a lot more. I can see a lot more coming in. Brilliant. We're going to move on. Let's dig in first. The first thing we're going to look at, actually, if you remember, is not the Muppet Show. It's vocabulary, right? Let's have a look, let's dig in or dive in and speak English about hospital vocabulary. I'm going to start with places in the hospital, right? So clearly, hospital is the first one, but notice the pronunciation, right? Hospital. but the accent is on the hospital. And the toll is a dark L, toll. Can you see the tongue? Toll. And the tongue touches the teeth. Hospital. And try and put the A at the beginning. A hospital. A hospital. Perfect. A hospital. I work in a hospital. Easy. Many of you do. Now, we can say to go to hospital. In the UK, we say I'm going to hospital means that I'm a patient. If you say I'm going to the hospital, it means you're visiting or you work there. Okay, this is in the UK, only in the UK. So when if somebody I know says, oh, I'm going to hospital, I'm a bit nervous because it means they're a patient. I'm going to hospital. If somebody says, I'm going to the hospital, I relax because they're just visiting somebody. You see the difference? This is a difference only in the United Kingdom. We have this difference. In America, they use this one for both patient and visitor or worker. For all of them, you can say to go to the hospital. So if you're not sure, you can use this for all of them. But you can just see there in the UK, there is a difference, right? Places in the hospital, we've got the A&E ward, which is the accident and emergency ward. So if you have an accident, you go straight to the emergency ward, the A&E, A&E. Instead of saying A and E, we say A and E, A and knee, knee, like knee, your knee, A&E ward. Go to A&E. You should go to A&E. That's a ward. A ward in general, a general ward, is just an area in the hospital with beds for the patients. So the ward, or the general ward, will be one of the many areas for patients. So when you go to a hospital in England, you'll have Ward A, Ward B, Ward C, Ward D. So if you're visiting somebody, you'll have to ask which ward are they in. Another place in the hospital, of course, is the operating theatre. The operating theatre is where surgery takes place. That's where the doctor or the surgeon, like Mr. Bean, will do the operation, like Alexander had. He had surgery. He was in the operating theatre. It's interesting we use theatre, right? Because theatre is actually where you go to watch a play, like Shakespeare. That's theatre. But maybe because they're playing the role of a doctor, anaesthetician, the nurse, everyone's playing a role maybe. It's like a theatre. I'm not sure, but we say the operating theatre. Interesting, right? Okay, excellent, good. Eva says she's focusing on my teeth. Why are you focusing on my teeth? That's very, very strange. Jean, welcome. Businesswoman from Uganda. Lovely to see you here. Ali is a radiology technologist. Okay, excellent. Julia says XYZ has gone to hospital. Yes, XYZ being your friend, right? Has gone to hospital as a patient. Yes. Can you tell us the difference between in hospital and at the hospital? Yes, basically. So Huda, it's a good question. In is you're inside the building. At can be both inside the building and next to the building. Okay, that's it. Simple as that. So if somebody says, I'm in the hospital, you know you must go in the door and look inside. If somebody says, I'm at the hospital, they might be just outside, next to it, or possibly inside. That's it. Great question. Good. Mukhtar says, I've been working a hospital. I've been working in a hospital. Let's say, we'll say in a hospital, right? I've been working in a hospital for 5 years. It's draining, right? It's exhausting. I can imagine it's exhausting, indeed. Let me just help you here, if I can. I'm going to help you, Mukhtar Ali. Just say, and also notice 5 years. I'm just going to help a little bit. It will help everybody as they see. I've been working in a hospital for 5 years and it's draining. I love the word draining. Really exhausting. That's what I hear about, yes? Okay, excellent. Ed says, maybe surgery is an art. Yeah, talking about the operating theatre. Maybe it is. Absolutely. Hytham says, is surgery a special clinic? So it can be. Surgery is the operation, but also doctors say I'm in surgery, meaning I'm doing the operation, I'm in the operating theatre. So to be in surgery could be to be in the operating theatre. Yes. Can you explain the pronunciation of theatre? Theatre. Theatre. Can I explain it? So you've got the th, you've got the long vowel or the diphthong ia, thea, and then t, and the schwa, t. So you've got th, diphthong, t, theatre, theatre. Yeah, what more can I explain? That's it. Excellent, good. Hazera says, I've been working in hospital since 2015. Okay, good, great. Sir, can you give me an example between A and E? So A and E is, for example, if you are knocked over by a car, you go to A and E. If your son falls from a tree and breaks his arm, you go to A and E. Any accident or emergency. Imagine you're at home and you're chopping the vegetables and you cut your finger, and there's lots of blood. Don't ring the doctor, go to A and E. Excellent, nice, good. Hikran says, I'll be working in a hospital as a volunteer within a month. Great. I wonder, are you practicing to be a nurse or a doctor, or is it just a volunteer activity, something you're interested in? So we've looked at places, right? Let's look at people in the hospital. Now, obviously, one of the main people, I guess, is the patient. Patient. Again, so you've got the diphthong a, pay, as in pay money, patient. It's a sh sound, shunt. Again, when you say the a, say a patient, a patient, a patient. A patient is the person receiving care, normally a sick person, right? So it's a person receiving care or treatment. But notice that patient, exactly the same pronunciation as an adjective, means having patience or not being in a rush. If you are patient, then you can wait. You're not in a rush. So you can put both together. For example, I'm not a patient. I want to get better as soon as possible. A patient, right? Because these two words have the same pronunciation but a different meaning, you can guess it's easy to make jokes about this, right? So, for example, when a friend of mine was in hospital and he was shouting at the nurse, "Can you hurry up with my medicine?" And the nurse says, "No, you're a patient," right? Meaning be patient, you're a patient. So lots of jokes you can make. Dad jokes. Now, patient, there are two kinds, right? There's the inpatient and the outpatient. Inpatient, accent on the in, an inpatient is a patient who must spend the night in the hospital. it's logical, right? That's why it's an inpatient. It doesn't mean you're going in the hospital. It means you're going to sleep in the hospital. So if you have an operation, sometimes you have to stay overnight. You will be an inpatient. If you go to the hospital and you only stay for an hour or 2 hours, maybe they do a blood test and say, you're fine, go home. You're an outpatient. So there's an inpatient ward and an outpatient ward. Out because you're going out in the same day. Okay, an inpatient, an outpatient. For example, we can say, I've been admitted as an inpatient. Okay, we talk about admitting a patient, which means to let them in or to register them. I've been admitted as an inpatient. Or the growing number of inpatients is a rising cost for the government. Of course, because we have to pay for the bed and the food and the doctor's time and everybody's time. The growing number of inpatients is a rising cost for the government. Okay, great. So Roman says, I was admitted to the hospital as a patient last year. Very good English, right? Admitted to the hospital. Great. So you were registered there. I hope, well, I assume you're okay now. I hope so. Yes. Great. Great English. Impatient also means that you're not patient. Right. Because you've got impatient, right? And it's with a M, but your right pronunciation is the same. Impatient. It's actually the same pronunciation, impatient. So you can be an impatient, right? You can be a patient, and an impatient. Does outpatient have a patient meaning? No, it doesn't. No, but it's a good question, right? It's a very good question. Okay, nice. People. Also, of course, we've got the doctor. Doctor, I mean, generally speaking, we can talk about synonyms for a doctor. A physician, quite hard, right? Physician. So it's a f and a s. Physician. And then the j. A physician. I should put the phonetics, right? So you can just get it clearer. Let me just share the phonetics to make it a little bit clearer. Physician. Wow, complicated word. Sounds like fizzy, like a fizzy drink. Fizzy, physician. Fizzy. So it's a voiced z. Physician. That n is almost disappears. Physician. And the stress on the si or the z. Physician. Can also talk about a medical practitioner. All of these are synonyms generally for a doctor. Of course, there are many kinds of doctor, as we will see shortly. You can say to see a doctor. In some languages, I think you say like to visit a doctor. I'm going to visit the doctor. In English, you wouldn't really say visit a doctor. You say, I'm going to see a doctor, right? I need to see a doctor or the doctor. I'm going to see the doctor. I'm going to see a doctor. If you know which doctor, then it's, I'm going to see the doctor. You can say to go for a checkup. So a checkup is just a medical examination. So many times people go to see the doctor for a medical checkup, medical examination. Often we call it a routine checkup. Once a year, check your body, have a routine checkup. For example, you can say, you seem to be very sick, you should see a doctor. Or, I'd like to make an appointment for a checkup. Make an appointment for a checkup. Juliana, it sounds like saying the word decisions, physician. Yeah. It's a good way of remembering it, right? Yes. How momentous pronunciation is in IELTS examination? Well, it counts for 25%. So it is important, right? Gamer, Sir Water? Who is Sir Water? There is so much difference between British and American accents, so who should we prefer? It doesn't matter. It really doesn't matter. Both are fine. In fact, don't worry about having one or the other. Just speak the way you speak. Accent is not that important. Above all, in IELTS, it is not important at all. Okay? The accent. Pronunciation, yes, but your accent doesn't matter. From the doctor, let's talk about nurses. Of course, we've got a nurse. Sometimes we talk about a registered nurse. So different countries have different systems. You can be a training nurse and then a registered nurse, which means you become officially qualified. There may be different grades of nurse in your country as well. It all depends. And again, there are different types of nurses, which we will look at in a moment. And systems. So we've looked at people. We've looked at places, people, systems, the healthcare system. In England, it's called the National Health, NHS, the National Health System. But we talk about healthcare in general, and the most important is primary healthcare. I think this is the most common thing that you will hear, the primary healthcare, which basically is the first point of contact with the national health system. So that could be your community doctor, it could be the pharmacy, it could be the dentist or a dental service or eye service. GP is the community doctor, basically. In England, we call that a GP. Your GP is your local doctor, your local community doctor. They're the primary healthcare. Your secondary healthcare will then be if you need to go to see a specialist. So the care of a specialist. So you go to your doctor, primary healthcare. I don't feel very well. He says, ooh, something wrong with your heart. You must go and see the cardiologist or the heart doctor. That then will be secondary care when you go to see the cardiologist. So the local doctor, the GP, is going to be your primary healthcare, and the specialist is the second step, the secondary healthcare, right? In England, we also talk a lot about social care, and social care is often outside the hospital in people's homes, care given to people who need daily help, usually at home, like eating, washing, moving. So some people who maybe have done a surgery and they cannot move, they're in bed at home, they need social care. Maybe somebody has a disability and they need help at home, or maybe you're just very old. As you get older, you may need social care to look after you at home. Okay. In England, or the UK, there's a lot of private organisations do social care, some government as well. Yes. Okay. Is physician expert in the branch such as cardiologist? So physician is the general area, right? That's any kind of doctor. And the cardiologist is a kind of physician, right? It's a specialist, a specialization, if you like. Yeah. Okay. Let me just see, where are we? I think you mean in the, is physician expert in the branch such as cardiologist? So yeah, so it's the other way around, right? The cardiologist is a branch of the physicians. Physicians is much more general. Okay. Sarah says neurologist, cardiologist, dermatologist. Yep, all these ologists are different kinds of doctors. There's lots of them, right? Okay, great. Excellent, good. Somebody's asking about checkup. Should it be one word? It's a very good question. Should checkup be one word? Let's double check. Well, it's interesting, right? So, yeah, okay. Over here in my Cambridge dictionary, it says checkup with a hyphen. In the US, it's done as one word, if you can see that. So in the UK, it's done with a hyphen. In the US, it's just one word, a dental checkup. Yeah, very good point. Well done. Well spotted. Nice. So where was that? Let me go back. Checkup. Thank you for that. A checkup. Excellent. Good. LKC, you're on the ball. So we've got social care and preventative care, right? Preventative care is to prevent disease. It's a big discussion in the UK, preventative care. Do we do enough? You've also, of course, got private healthcare and public healthcare. If you have money, you can buy private healthcare. If not, you go through the public healthcare system. And all of the people in the hospital, well, the doctors and the nurses, you can call a healthcare worker. So those are the jobs in the hospital that look after people, right? The healthcare worker. Okay, excellent, good. I think we're there. Lots of vocabulary, a lot of vocabulary, okay? Hazara says, tomorrow I have an appointment for a checkup. I wonder, is that true or are you just practicing? I never know with students here. Are you really doing it or practicing? Just let me help you a little bit, Hazara Panna. It's for a checkup, right? A checkup. Maisha official, hello, young man, love from Bangladesh. Oh, please read my comment. Well, there you go. Read, done. Zara says, I'm focusing on your pronunciation of the letter R to get the British accent. Ah, interesting. Could you provide a list of these vocabulary related to medicine? Well, yes and no. Not right now, but Irene, there is on YouTube a live lesson on medicine. So if you search Keith live lesson medicine, there's a whole live lesson on medicine. Get the PDF for free and you can get it there. Yes. Is fluency the most important in speaking section? No, not at all. So there are 4 things, right? This is IELTS. Fluency, vocabulary, grammar, pronunciation, they are all the same importance. 25% fluency, 25% grammar, 25% vocabulary, 25% pronunciation. GP is a general practitioner. Yes, Mad Max. Absolutely right. Yes. Okay. Good. Home visit. Yeah, home visit is where the nurse will come to visit you at home or the doctor. So if you are unable to go to the doctors or the GPs or the hospital, you can have a home visit and the doctor will come to you. Yes. Great. Nice. Okay, good. Wealth. Your lessons are really cool. Nice, good. Okay, so listen, let's move on because we have been looking at, vocabulary. We've seen quite a lot, but let's start practicing. Let's start using it. Let's introduce the surgeon, Mr. Bean. We're going to do a listening bingo. So this is a listening activity that we're going to do together. And I just need a quick drink.
Open your ears, open your mind. It's time for a listening exercise. Maybe a dictation, but without intimidation. Maybe a listening bingo that can open a new window to discover your new listening skills. So listen with me.
Okay, let's develop your listening skills. So what we're going to do is we'll listen to a doctor talking about his role in the hospital. Okay, as you listen, answer this question. How many kinds of doctor are mentioned? So to mention is to say, right? To talk about. How many kinds of doctors are mentioned? Are you ready? Let's listen very, very carefully. It's quite short, but here we go. What's the role of a doctor in the hospital? That's not an easy question because there are many types of doctors. One of the most common is what we call in the UK a GP, a general practitioner. And actually, this doctor doesn't work in the hospital. He or she works in the community, offering primary healthcare. They will see patients for checkups or special problems. They have to recognise the symptoms, make a diagnosis, and in many cases, prescribe medicine. Sometimes they might refer a patient to a specialist if they need more specific treatment. Now, in the hospital, there is a wide range of doctors, including paediatrics, who treat children, oncologists, who deal with cancers, pathologists, who study the cause and effect of diseases, surgeons, who carry out operations, and many, many more. Basically, a doctor's role is to make sure patients that are sick, physically or mentally, get the treatment they need to get well. And doctors should also provide advice on preventing sickness and disease. In a nutshell, that's it. Right. How many kinds of doctor are mentioned? Carolina Segura, thank you very much for your comment from Spain. Hello, neighbour. Brian, you say you don't go to the GPs, right? Just go to the hospitals. I know a lot of Asian countries where that's the case. There's no GP. You go straight to hospital. Let's see. Where are we? We've got, let's have a look. Vicky says 5. Eva says 5. Daniela 2. Sarah Nora Nue, GP, pediatrics, oncologist, pathologist 4. Interesting. Tran says 5. Cesare says 5. Milda says, is that a new avatar? No, you say 5. GP, paediatrics, oncologists, pathologists, and surgeons. Wow. Artyom has got the same. Aziz says 7. Mashura says 7. Ryan says 6. 5. Okay. Right. Very, very interesting. Okay. Let's see. Amaryllis, you've got. Okay. Almost. Sibel, GP, paediatricians, oncologist, petologist. Ooh, what's a petologist? Interesting. Surgeons. Right, let's find the answer. The answer actually is, let me bring it up for you. The answer was 5. The GP, general practitioner, pediatrics. So this is in plural, right? Pediatrics. So you can practice your pronunciation. Oncologists. Let me emphasize, just to help you. You're not going to use these words, I know. But just in case you're in the business. Oncologist, pathologists, surgeons. There's the stress. General practitioner. Great way of showing the stress. There are 5 pediatrics, oncologists, pathologists, surgeons in the plural. Great, good. Look at me, perfectionist. There are 5 different kinds of doctors mentioned. Now then, that's the first activity. The second activity is, I want you to listen again. And I want you to mark the boxes that contain the exact words you hear. Let's put them up here. Okay. Mark the boxes that contain the exact words. So not similar words, but the exact words, right? So if you hear difficulty question, it doesn't count. If you hear difficult question, then yes, you mark it. And when you get like maybe 3 in a row, bum, 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 if you hear these 3, just in your head, mark it. And then in the chat, type bingo and the words. And it's the first person to type bingo and the 3 words in the chat. It can be this way, it can be this way. Sorry, it can be diagonal. It can be, it can be horizontal, vertical, or diagonal. Me and maths, horizontal, vertical, or diagonal. Okay, just give me a quick thumbs up when you're ready to listen again. Hazara, the meaning of in a nutshell means overall, in sum, or in short, right? When you have a lot of ideas in a short sentence, in a nutshell means in sum, in short, or overall, right? Right, okay. Listen, Isadul, you can't do bingo yet. We've not begun yet. Right, I've got the thumbs up. Excellent. Let's listen again. Here we go.
What's the role of a doctor in the hospital? That's not an easy question because there are many types of doctors. One of the most common is what we call in the UK a GP, a general practitioner. And actually, this doctor doesn't work in the hospital. He or she works in the community, offering primary healthcare. They will see patients for checkups or special problems. They have to recognise the symptoms, make a diagnosis, and in many cases, prescribe medicine. Sometimes they might refer a patient to a specialist if they need more specific treatment. Now, in the hospital, there is a wide range of doctors, including paediatrics, who treat children, oncologists, who deal with cancers, pathologists, who study the cause and effect of diseases, surgeons, who carry out operations, and many, many more. Basically, a doctor's role is to make sure patients that are sick, physically or mentally, get the treatment they need to get well. And doctors should also provide advice on preventing sickness and disease. In a nutshell, that's it.
Excellent. Great. We've got, let's see, Artyom got bingo. Right. Vicky was the second. Who else? Anybody else? General practitioners prescribe medicine preventing sickness. Yeah. Alexander as well. Great. Good. I realized after doing this that it wasn't a very good exercise because as soon as you know that this one is true, the only possible answer then is for all of these to be true, right? It has to be. That has to be the answer. Because it's bingo. You can't go any other way. So I have to construct my bingos in a better way. But that was it. Excellent. General practitioner, prescribed medicine, preventing sickness. Excellent. Good. Now, what I'll do, I'll just play it one more time. And as you listen, I will indicate the right answer so you can all of you hear when the right answer comes. More listening practice, the better. The more you listen, the better for you. Okay? Let's do it.
What's the role of a doctor in the hospital? That's not an easy question because there are many types of doctors. One of the most common is what we call in the UK a GP, a general practitioner. And actually, this doctor doesn't work in the hospital. He or she works in the community, offering primary healthcare. They will see patients for checkups or special problems. They have to recognise the symptoms, make a diagnosis, and in many cases, prescribe medicine. Sometimes they might refer a patient to a specialist if they need more specific treatment. Now, in the hospital, there is a wide range of doctors, including paediatrics, who treat children, oncologists, who deal with cancers, pathologists who study the cause and effect of diseases, surgeons who carry out operations, and many, many more. Basically, a doctor's role is to make sure patients that are sick, physically or mentally, get the treatment they need to get well. And doctors should also provide advice on preventing sickness and disease. In a nutshell, that's it.
In a nutshell means in short, but it's a different word, right? Okay, I hope then you can hear where the answers are coming. Well done, all of you who got the bingo. Very, very nice. Well done, all of you. Excellent. Good. Let's move on. What's coming up next? Well, I'll tell you what, before we move on, let me go through the script because this will help you just identify some of the words, right? I'll go through, I'll play it one more time, and you can listen and connect the words with the sound, and I'll just explain any other words at the end as well. Okay, great.
What's the role of a doctor in the hospital? That's not an easy question because there are many types of doctors. One of the most common is what we call in the UK a GP, a general practitioner. And actually, this doctor doesn't work in the hospital. He or she works in the community, offering primary healthcare. They will see patients for checkups or special problems. They have to recognise the symptoms, make a diagnosis, and in many cases, prescribe medicine. Sometimes they might refer a patient to a specialist if they need more specific treatment. Now, in the hospital, there is a wide range of doctors, including paediatrics, who treat children, oncologists, who deal with cancers, pathologists, who study the cause and effect of diseases, surgeons, who carry out operations, and many, many more. Basically, a doctor's role is to make sure patients that are sick, physically or mentally, get the treatment they need to get well. And doctors should also provide advice on preventing sickness and disease. In a nutshell, that's it.
Right, okay. Good. I'm going to come to your question of paediatrician and paediatrics in a moment. Okay. So, general practitioner, as we mentioned, is your local doctor in the community. We can maybe call that a community doctor. That's something specific in the UK. I don't know if in your country you have the same or not. So they don't work in the hospital. Primary healthcare, we talked about. Checkups, spelling it correctly, we've talked about. Recognize the symptoms. So recognize the symptoms. The symptoms are the signs of sickness. So if you cough, that's a symptom, right? It's a sign that there is a sickness, right? So they have to recognize the signs that you are sick. Make a diagnosis, which is to identify the sickness. Identify the sickness. So if you cough, that's a symptom. The diagnosis is you have the flu, or you have a cold, or you have pneumonia. That's identifying the sickness. Prescribe medicine is a good collocation to know. It just means to give or allocate medicine, to give medicine. It's actually not to give the medicine. It's to, because the pharmacist gives the medicine. The doctor writes the medicine you should take, right? So what we say to prescribe medicine is to give, not to give medicine, but to write, to say which medicine you should have. What's a good way of defining prescribe? Let's look it up. Order, advise, authorize the use of. Advise and authorize the use of. Advise, to advise and authorize medicine. Okay. Advise and authorize medicine. Prescribe. Yeah, because they're not giving it, are they? The pharmacist or the chemists. The chemist will give it. So refer a patient to someone is a good one. So that's to send them to a specialist. Specialist obviously is a doctor in a special field. There's a wide range of doctors, including pediatrics. Okay. Now, I'm not a doctor expert or a health expert, so I'm not sure what the difference is. Pediatrics is the branch of medicine with children, right? So it's pediatrician. Let's go and check. It's probably then pediatrician. Yes. Come with me into the world of Cambridge Dictionary. Pediatrics is the science or study of medical care for children. He specializes in pediatrics. So it's pediatrician. Pediatrician, a doctor who has special training. There you go. That is the answer. So thank you, all of you, for pointing that out. My mistake. I do apologize. Pediatrician. Oncologists. I mean, obviously you don't need to know these, but it could be worth learning one or two. If you work in a hospital, obviously you probably know this. Get treatment or get the treatment is a good collocation. And preventing sickness and disease. In a nutshell, we said means in short. There, we've got it. Excellent. Good. Right. Now, Vicky, thank you for that. I know you and several others were bringing up the pediatrician thing. To order a medicine might be better. Kind of, yes. But again, I think it's the pharmacist that orders the medicine and the doctor that authorizes, if you like. Yeah. What's the meaning of in a nutshell? In short. Just meaning a lot of ideas in a short phrase. So often at the end of a speech or the end of a talk or the end of a story, you can put all the ideas into one sentence and say, in a nutshell, this is the role of a doctor. Okay? Right. Excellent. Good. Let's move on. Where are we? We've gone. Let's have a look. We've been looking at listening bingo. Let's move on to idioms. This is the next one. Idioms. In which case we need this.
I want some idioms, and I want them now. I want some idioms, but I don't know how to learn them, how to remember them. All I know, and I really think so, is that I want some idioms now. I want some idioms, and I want them now.
Oh, I want some idioms and I want them now. Great. Idioms. We're going to talk about different idioms. Just before we do, I just noticed I forgot to mention an amazing website. It's from the NHS in the UK and it's called healthcarers.nhs.uk. And maybe Burns, you could share this website in the chat with me, with everybody. But just if you're interested in the role of doctors and the role of nurses, this website gives you information about exploring different roles, right? Doctors, health informatics, all different people, midwives, nursing, pharmacy. In the role as a doctor, they talk about all the different areas, anesthesia, and it just gives you a bit of information about that role. Clinical oncology, radiology, general practice, right? Being a GP. So notice this is the field of work rather than the doctor. And I think that's where I made my mistake. This is the field of work, right? Rather than the doctor. The doctor is the pediatrician. Pediatrics is the area. So if you're interested in finding out more about the roles of a doctor, there's some really nice information here. Very, very simple, easy English. This whole website is full of really interesting stuff if you want to investigate a little bit more this field. Okay, great. Let's move on to idioms. So I've mentioned there, hospitals, healthcare. Can you guess these idioms? I'm going to show you a picture and I want you to guess what the idiom is. What do you think the idiom is, right? Are you ready? Here is number 1. What do you think this is? Brian, you're asking about GPs in Spain. In Spain, they have something, they have a GP, yes. They call it the head doctor or the family doctor, but it is a GP in effect. Elvira, well done. But what about this one? This is a different idiom. What can you see in the picture, guys? Any guesses? Be the crafter. B is good, you can see. What about the arrow? Where is the arrow? Busy as a bee, maybe? Be a patient. Be the line is a very good guess. Not quite. Be the sower. Okay, so the sower, what's another word? What is the sower doing? Irina, you're a star. Be the sower. No. Layla, thank you for your comments. Be the bee's knees. Maybe. Haha. Be on pins and needles. Very good test. Very good guess. Very good guess. But be a surgeon. Not quite. Yeah, be on the line. Be the seamstress. You're not quite there, but you're very good guesses. Okay, let's go back. One of you got it right. Just one person so far has it right. The answer for this one is the following. Let me show you. To be on the mend, right? Be on the mend. The sower is mending. To mend is to fix or repair. To be on the mend, well done, Irina, is to be getting better or recovering from a sickness. For example, I was off work ill for 2 weeks, but now I am on the mend. To be on the mend. So when you're getting better, you can say to everybody, I am on the mend. I am on the mend. It's like your body is fixing itself, is repairing itself, right? Excellent. Good. That was it. That was number 1. Let's move on to number 2. What about this one? Can you guess this idiom? This one will be easier now. Same idea, but different meaning. Yes, Sarah, right as rain. Right as rain means you're fully recovered. On the mend means you're in the process of recovering. Okay, Oh, you're all so close. And this is the beauty of idioms, right? Mackenzie and Jasmine channel. I'm just guessing. Is that a YouTube channel? Very good. Well done. Excellent. Well done, you. So, to be on call. A lot of people said to be on a call, to be on the call. No, nothing. To be on call. If you look at the picture, well, it's hard, I know, but be on call. Yeah, without the. I should have done cross. To be on call means be available at any time needed, but not officially on duty. So you're not. I'm not sure. I don't think you're paid, at least not full pay, if you're on call. So you're not working. You may be enjoying time with your family, but you must be available to be on call. For example, some doctors have to be on call over the weekends in case there's an emergency, right? So it just means be available, be on call, be available. Just be careful. No no the, no nothing, on call, to be on call. Okay? Well done. Some of you got that. Well done indeed. Right, next one. Number 3. What is this? Can you guess this idiom? Seamus, about feeling sad and a bit better. Not really. On the mend is more about health and sickness, not sad and happy. Empty the clock? What? Round the clock, round the time. That's enough. Yang, thank you very much. Shizuka, spot on. Round the clock. Round the clock, as you can see. Very good guesses from a lot of you, but the answer is round the clock. And this means all day and night, or more idiomatically, just non-stop. For example, some nurses work round the clock at the weekend. Some nurses work round the clock at the weekend. Okay, so you can work round the clock. You can say to work round the clock. You can say to be on call round the clock. If you're a student, maybe you study round the clock. The night before an exam, you may study round the clock. Basically non-stop, right? All day, all night, 24 hours. But it's idiomatic, so you can be more liberal in your use. Great, round the clock. Excellent, good, well done. Round the clock. Let's move on. The last one. Number 4. Can you guess this one? The last one. The easy one, maybe. What can you see? Nice one, Daniela. Yeah, rock around the clock. Exactly. Nice, Sarah. Oh, you're on the right lines, Samira. This is a bit hard. Sybil, almost. I like it, Edith. Good guess, Raihan. Let me stop you there. Oh, hang on, another one. This is a good guess. Little Jewel, very good guess. Out of the jungle? Right, okay, some very, very good guesses. Let me bring you back in together. This one, not to be out of the forest, but to be out of the woods. The woods is another word for forest. Definitely in the UK, I think we say the woods is the forest. So we don't normally say to be out of the forest, we say to be out of the woods with a plural S. Okay, and it means to be out of danger. Usually we use it in the negative, right? I am not out of the woods. For example, the patient is stable now. So that means the patient had a problem, but now they are okay. Let's make it easier. The patient is better now, but she's not out of the woods yet. So it means she's not completely out of danger. Maybe there was a big accident, they were sick, they did an operation, and she's better, but she's not out of the woods. Okay. We can use this not just about hospitals, but at work, with friends, any kind of situation, even kind of joking a bit where you're, where you're in trouble for something. I'm trying to think, for example, with children, when children do something bad and the parents find out, and the children think that they've got away with it, that they're okay, but they may say, "Oh, I think we're okay, but we're not out of the woods yet. Our parents may find out what we've done." So you can use it in different contexts, but it's very common in the hospital context where a patient has an operation and they're better, but they're not out of the woods just yet. So they're not 100% better. They're not out of danger. Right, good. 4 idioms. I have a bonus idiom for you, which was the last one. The bonus idiom was to be in the thick of it. To be in the thick of it means to be deeply involved in an activity or situation. Any kind of situation or activity, and you are involved, doing a lot there. For example, hospitals are nearly always very busy, and as nurses, we are in the thick of it. We're in the center of the activity. We're deeply involved in the activity. That's it, to be in the thick of it. Again, you can use this for work, for hospitals, for families. There's a lot of activity and the parents are in the thick of it. When you're organizing a birthday party with all the children, The parents are in the thick of it. They're in the center of all the activity. Okay. A lot of idioms. I don't want to throw too much of you, but this is just a reference that you can have and can use. Okay, excellent. All the idioms. What's up next after idioms? Let's find out. I forget myself. Interview with a nurse. Are we doing an interview with a nurse? Before we do interview with a nurse, let's take a little break. Very, very short break. I want to introduce something to you because I mentioned at the start of this session an idea to help you review the live lessons. The live lessons are good, are they? Well, the live lessons I think are okay, but they're long and there's a lot of vocabulary, right? There's a lot of information. Sometimes, too much information. So I've developed a way to help you review the live lesson. Very, very simple. So in the live lesson, right, you've got, as you can see, you've got the PDF. You get a PDF like basically this one. So this is the PDF. It's got all the vocabulary. So with that PDF, you can then review. But how do you review? Well, I've found a way to help you review the vocabulary so you can do it even more and make your learning even deeper. So I want to show you very briefly what this is. And it's basically, it's not a course, it's a library. It used to be called the library, basically, but it's called now the Vocabulary Vault. Okay, and the Vocabulary Vault puts all of these PDFs together and helps you learn the vocabulary more deeply so you can use it in conversations. The best thing is, let me just show you here on the website. I'll show you how this works and where you can find it and how it works to help you, right? Let me show you. So at the moment, when you come to the website Keith Speaking Academy, you can go to the free live lessons, which you're watching today, and you can download the PDF from the lesson. Now that looks a bit like this, and you get lots of information, all the vocabulary, the activities that we've done in the lesson. Now, the lesson on the live lesson obviously takes about 2 hours, but what I've done now is I have taken this vocabulary and made a pronunciation file that you can practice. It's a 15-minute file. You can practice all the vocabulary with it, which is fantastic. And this has become a new course, and it's called the Vocabulary Vault. Used to be the library. The Vocabulary Vault, basically, when you go inside, you'll see that there's an introduction just explaining how it works here, how to use it. It explains the stories, the quizzes. So to help you learn the vocabulary, basically, let's take family. There's the pronunciation practice with this file from the live lesson. You go through, you repeat, practice all the pronunciation, the vocabulary. So it's going deep into your learning system. You can download this and you can watch the full live lesson if you like. But the important thing is you can listen to the audio and download the audio and do the practice. So that's the pronunciation practice. Then you can review with a little quiz here, which takes you through the different vocabulary, different ways of testing yourself. You can listen to the novel and also read the novel. So there's a story using all the vocabulary from the live lesson. It's a great way to review and to practice everything that you've learned. There are at the moment 17 different topics inside here. I'll be adding more, and it's a fantastic way to build up your vocabulary so you can use it effectively. The bonuses, well, there's one of my favorite books, Succeed in IELTS Speaking. It'll give you the insights to all the ways to succeed in your IELTS speaking test. And there's the bonus visualizations. These are like simple meditations where you just listen to my voice. I'm using all the vocabulary, in this case for study, and it's a kind of meditation, and it's a really interesting way to consolidate your learning of vocabulary. That's it. You can also get all of this in a podcast. You will get an email to get it into your favorite podcast player, or you can just listen to all of it here directly. That's it, the Vocabulary Vault. If you are interested, then you can go, it's normally $47, but if you go in to look at it today, for the next 5 days, there's a discount with the code 45 off. Here, it just explains to you what's inside, how it works. But if you then have a look, you can go to press 45 off, go to join and enter the code 450FF. In fact, it's already there. Fantastic. Great. And then buy, and you'll go straight in. And then you're there. That's how it works. Yeah, I hope that makes sense. So that's it. I mean, just to recap, to let you know, the Vocabulary Vault, it's basically to help you learn and use vocabulary more easily in your conversations. So it takes all the PDFs are free on the website, but to get the pronunciation files, the story, the quizzes, and the organization, then that's the Vocabulary Vault. Normally it's $47. For the next 5 days, including today, it's just $27. Just use the code 45 off. That's 45% off. 450FF. Just use that if you want to buy it, if you want to join. It's a one-time payment. It's not monthly, right? It's just a one-time payment for lifetime access. And of course, the good thing is I will be updating it each month. So once you're in, you get all the updates in the future. Okay. Excellent. Good. That's it. Just to let you know. Hazara, how can I develop my vocabulary? Well, that's the answer. That's the answer, Hazara. Okay. And a lot of comments about the idioms. I miss them. Nora, thank you so much for your comment. That's very, very nice. Deep water. Why are we talking about deep water? I'll try. I can't find your original comment. Never mind. Never mind. Keith, you are invited in Bangladesh. Thank you so much. Great. Great. This course is so worthwhile, especially that you get access for life. You do, yes. So you get all the updates. I'm going to do more updates this week, actually. So let's get back to revenons à nos moutons, as they say in French. Let's get back to the lesson, to the class. Where are we? We were having an interview with a nurse. So this is our next activity. It's an interview with a nurse, and I want you to watch the interview and answer this question. Does she like her job? Why or why not? Okay, simple question. It's a short interview. Does she like her job? Why or why not? Just put up a thumb if you're ready to watch. Joy, if your account shows 47, use the code, just put on the payment page, the code 450FF, and it will go to 27. Just use the payment code. Hélène, thank you. I've been practicing my French, you see. Okay, we've got the thumbs up. Does she like her job or not? Let's find out and see. Here we go.
I'm a nurse. Actually a registered nurse, and I work in the local hospital. Well, at the moment I'm responsible for looking after the inpatients in the general ward. I have to check their blood pressure, maybe carry out blood tests, and then give patients their medication. Of course, always trying to make sure that patients are comfortable as can be. You know we have a duty of care to all our patients, so we need to do everything we can to ensure their recovery. I also have to liaise a lot with the family of the patients, keeping them up to date and helping them understand the situation. Yes, very much, although it's a very demanding job. I mean, on busy days, you're in the thick of it, and when you're working shifts, long shifts, you can get very tired. There's a lot of wear and tear on the body because you're often lifting patients. And there's a mental toll as well. We do have to look after our mental health because we see some very disturbing situations, especially when patients pass away. But all said and done, I love this job, it's very rewarding.
Right. There we have it. The interview with Kelly, Nurse Kelly. The question was, does she like her job? Rahila says, my speaking examiner was similar to you, but it wasn't me. She likes the job very much, but it's a bit tiring. She likes the job very much. Because it's rewarding, says Samira. Mohammed says it's very rewarding. Yes, she does. Milda, that's a good answer. Well done. She loves her job, even though it's demanding and has mental toll when patients pass away, but it's rewarding. Yes, very much. She loves the job because it's rewarding. Great, Mintal. Very good. Nice. Yes. Yeah. Alexander Black. Well done. Yeah. M. Darkwell. Yes, it's very rewarding. Absolutely. As Vicky says, she likes her job. It's exhausting but rewarding. Exhausting and draining. Do you remember that word at the beginning? Draining, exhausting. Great. So the answer basically yes, because, whoops, can I spell? Because it is rewarding. I can't see my board because my microphone's in the way, right? Yes, because it's rewarding. That's the simple answer. Okay, what we'll do now, let's watch again. I want you to listen again. Actually, listen and watch again. And note any useful collocations. So collocations, like 2 or 3 words that normally go together. Just listen for any useful collocations. You can write them in the chat and then we'll come back. Okay, I'm going to help you. I'll put some subtitles on to help you. Let's watch again and see what she tells us. Here we go.
I'm a nurse. Actually a registered nurse, and I work in the local hospital. Well, at the moment I'm responsible for looking after the inpatients in the general ward. I have to check their blood pressure, maybe carry out blood tests, and then give patients their medication. Of course, always trying to make sure that patients are comfortable as can be. You know, we have a duty of care to all our patients, so we need to do everything we can to ensure their recovery. I also have to liaise a lot with the family of the patients, keeping them up to date and helping them understand the situation. Yes, very much, although it's a very demanding job. I mean, on busy days, you're in the thick of it, and when you're working shifts, long shifts, you can get very tired. There's a lot of wear and tear on the body because you're often lifting patients. And there's a mental toll as well. We do have to look after our mental health because we see some very disturbing situations, especially when patients pass away. But all said and done, I love this job, it's very rewarding.
Excellent. Great. Good. Juana Maria from Cuba, welcome. Okay, good. As comfortable. Yeah, nice. Let me just put up some of your collocations. Great. Ola awalola, you're right. Yes, it is a I. You're right. May rush, good. Blood pressure. Mafakur, nice, excellent, good. Sir, pass away, lovely. I love your avatar. Nice, Imaj, very nice. Dominica, nice to see you here. Great. Sani Bajoga, lovely. Long working shifts, yes, I think. Great. Up to date, lovely. Miranda, nice. All said and done. Nice, very nice. Hatham again, mental toll, good. Sir, how can I join your classes from Bangladesh? Go to the website, Keith Speaking Academy, click on the courses, and you can join. Simples. Brilliant, good. Nice, very good. Busy days, good. Pass away, all of them, great. Very, very good. Excellent. Let's have a quick look together, right? I'll just highlight some of the collocations. Registered nurse, I think, is a good one. That's like an official nurse. Okay. What does your job involve? Well, at the moment, I'm responsible for, that's a good one for any job. I'm responsible for teaching IELTS students or teaching English to adults. Looking after the inpatients we talked about, right? The general ward, which we talked about. It's the area with beds for patients. Blood pressure, we talk about check your blood pressure. Carry out blood tests. I'll put blood tests. You can say carry out or do blood tests. Give medication is a good one. Medicine or medication. Medication is more general. Medicine is a specific kind. As comfortable as can be. I think that's quite a nice one, right? As comfortable as possible. A duty of care is a good one. A duty of care is a responsibility to look after somebody, if you like. It's almost, it's a responsibility. It's like a civil responsibility. So parents have a duty of care for their children. Teachers have a duty of care for their students, right? We should look after them. Everything we can to ensure their recovery. I also have to liaise with the family. So to liaise with somebody, like, is to communicate with. That's a nice expression. To got hairs, don't know why, dust and hairs. Communicate with. To communicate with the family or with somebody to liaise with. Teachers liaise with parents. Nurses liaise with the family, and they liaise with the doctors, of course. Keep up to date, right? Keep them up to date. Let them know what's happening. It's very demanding on busy days. Somebody said busy days. Yep, it's a simple collocation. In the thick of it, right? You're the center of the activity. Working shifts. So to work shifts. A shift is a period of work, normally like 12 hours. A morning shift, a night shift. It's a longer period of work. It's not exactly, let's call it it's not quite the best definition, right? A period of work. Let's go back. I'm trying to find, I'm just going to have a quick look. Come with me into the dictionary because a shift, I'm looking for a better definition. A shift to move, no. To change, no. Shift, verb, not to shift. Verb is a noun, a group of workers who do, okay, a shift, a group of workers who do a job for a period of time during the day or night, or the period of time itself. So it's a period of time that you work. Night, day shift. Okay, a group of workers who do a job for a period of time, or the period of time itself. So I think I'm right? It's a period of time. Period of work, a period of time that you work. There you go. Good old Cambridge, always helping, lending a hand. When you're working shifts, long shifts, you can get very tired. There's a lot of wear and tear. So wear and tear is, Cambridge, help me. Wear and tear is where something gets used and becomes old. Like your t-shirt, if you've got, this, is a new shirt because my old shirt had a lot of wear and tear. I was wearing it so much, it was tearing, it was old. So when something is used a lot and it becomes old, that's wear and tear. So your body suffers wear and tear, right? As a nurse, you're doing a lot of activity, so there's a lot of wear and tear on the body, right? Let's call it damage. That's probably the easiest word. Damage, wear and tear. It can be for clothes, for the body, for your car, for books, for a computer. In fact, anything, right? Wear and tear. It's easy to remember because it rhymes. Wear and tear. Wear and tear. So a mental toll, when something takes a toll, it has a negative impact, right? There's a mental toll. So there's a negative impact on your mental health. A mental toll, a negative impact on your health. A physical toll is a negative impact on your body. So wear and tear is physical toll. We do not have to look after our mental health. Again, mental health is a very common collocation. Pass away, meaning to die. To pass, to die. Or just to pass, you can say to pass on also, we can say. All said and done. All said and done means at the end of the day, or in the end, at the end of the day, metaphorically or idiomatically, basically, in the end, I love this job. It's very rewarding. But all said and done. Again, the and becomes un. Said and done. All said and done. Wear and tear. It's just a un. Wear and tear. Great. Oh, hallelujah. 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 We've arrived. Can I say a physical toll? Yes, you can. Yes. Yes. Could you spell literally? Literally. 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 To work in turns. To work shifts. To work in turns. I'm not sure if that's the same. I work in turns. Work shifts, definitely. Right? We say to work shifts. I work shifts. As a nurse, I work shifts. We do use turns, but I'm not sure we say to work in turns. I'm not 100% sure on that one. Is that maybe an American one? Work in turns, to work in shifts. Okay, yeah, to work at different times. We don't use it so much in Britain, I don't think, but yes, to work in turns, you can say yes. Excellent. Mohsen, you've just arrived. Oh dear. We're almost at the end. So we've been through. Listen, let me just recap where we are and what we've done. I'm going to come over here. We've been looking at hospitals, right? We've been looking at vocabulary, particularly around places in the hospital, people, systems, the healthcare system. We've also been looking at the listening bingo. Listening. Doing our listening skills, listening to a doctor talk about his role as a doctor. We've been looking at, idioms, to be in the thick of it, at the center of the activity, to be on call, to be on the mend, all of these. We've listened to this interview with an AI nurse. It was an AI nurse, I know, talking about the role of the nurse and looking at collocations. Let's finish up with a game of Kahoot. And Kahoot is a simple game. We're just going to review some of the key vocabulary from today and see who can be the winner. Okay. Let me see. Collocation. A collocation, Sadia, is just one or two words that normally go together. Diana, the difference between collocation and idiom. So they're different. A collocation can be any two words that go together, like cup of tea, white wine. An idiom means it has a non-literal meaning. It has a metaphorical meaning or a different meaning. So pass away is idiomatic, meaning to die, and a collocation. Basically, collocation is bigger and idiom is a small part of that. So most idioms are collocations. Okay, great. Kahoot, let's get in there. Let's play. I need to just sign in to my account and then we can do it. If you don't know, if you don't know Kahoot, basically stay with me here. I'll put the questions here. You can then go on your phone and go to kahoot.it and then you can, or there's an app, you can download the Kahoot app and then just put in your name and the PIN and we will play. You just then choose the answer. Let me show you what I'm doing. I'm just loading inside. I'm going to put the questions here. We'll play the classic mode. So you go to kahoot.it or download the app on a different tab, put in your name, put in the PIN 6225364. Burns, if you could just help share the PIN with everybody, that would be fantastic. And then we'll just wait for you to join. And then you'll see the questions here. And then in the Kahoot in the other tab, you choose red, blue, yellow, or green for the right answer. It's multiple choice, right? You've got it. Kareem says, nurses are called angels of mercy. How nice. Could you send the link for it? Absolutely. Kahoot.it. There you go. And there's the pin. Thank you, Burns. Tulien, I haven't talked about dentistry. It's such a specialized field and there was so little time to cover everything. I just scan it on the camera and it works. Oh yes, of course you can use the scan. Yes, thank you, Sarah, for showing that. Awa says, I really needed this session but came in late. Don't worry, because Awa, you can watch the recording on YouTube. It will stay there, or Facebook. Okay, we've got quite a few people in. Let's just give you a few more seconds and then we can do it. Right. Okay, guys, I think we're all there. Let's start. Here we go. Question number 1. Hospitals. I need to stay in hospital overnight as an nurse, doctor, outpatient, inpatient. I need to stay in the hospital overnight as an nurse, doctor, outpatient, inpatient. Wow. Okay, 9 of you got inpatient. Yeah, it's an inpatient. If you're staying overnight, then it's an inpatient. It can't be nurse because it's an. If it were a nurse, that's possible. So in fact, that just wasn't a possible answer. Okay, inpatient means you're a patient staying overnight in the hospital. Next. Najim is at the top, Eva is second, and Sherry is third. Let's move on to the next question. I was sick yesterday, but today I am on the blank. Better, medal, mend, or well? I was sick yesterday, but today I am on the blank. On the better, on the medal, on the mend, or on the well? Let's see. Oh, well done. The vast majority of you got it right. On the mend. Exactly. On the mend means to be getting better. Not completely better, but in the process of getting better, right? Remember, on the mend means I'm getting better. I'm as right as rain means I'm completely better. Good. Let's see the leaderboard. Oh, things have changed. Eva has gone to the top. Sherry is in second and Aisan Islami is in third. Nona is the highest climber. Next question. After the checkup, the doctor blanked some medicine. Wrote, described, prescribed, or receipt. After the checkup, the doctor blanked some medicine. Wrote, described, prescribed, receipt. Sarah, I don't know the answer to your question. Prescribed was the answer. To prescribe medicine, right? You don't describe it and, well, the doctor wrote some medicine. No, they can write a prescription, but they prescribe some medicine. Okay, let's see how we're doing. Oh, things haven't changed at all, except that Evgenia is the highest climber, up 8 places. On to the last question. After the surgery, she is stable, but not out of the blank yet. Wood, woods, trees, or tree. After the surgery, she is stable, but not out of the yet. Wood, woods, trees, or tree. What do you think? Well done, Sarah, and also April and Samira. Well done. Woods, not out of the woods. She's not out of the woods in the plural, right? The woods in British English means the forest. So not out of the woods, still in danger. Excellent. Let's see the final podium. Third place. Oh, Vicky. Well done. Second place is Sherry, and first. Eva, well done you. Fantastic. Very, very nice. Congratulations to you. Excellent. Lovely. Well, that, my friends, brings us to the end of the session. Well done, all of you, for being here. Thank you so much for spending the time with me. I hope this is useful. Remember, you can keep in touch with me through Facebook at Keith Speaking Academy, Instagram, Keith Speaking Academy _, and go and check out the keithspeakingacademy.com is the website where you can find out everything you need to know about IELTS speaking. In there, you'll be able to see information about the test, speaking tips, and the free live lessons. Later today, I will upload the PDF for the latest one today on hospitals, and you'll be able to get that. And if you're interested in reviewing the vocabulary from the live lessons, go and check out, yes, you guessed it, go and check out in the online courses button, go and check out the vocabulary vault. It's there, you can find it. Now that's mine, so it doesn't show you, but you can find it there. Basically, the vocabulary vault is normally, it's there for $47, but for the next 5 days, it's just $27. Just use the code 450FF because it's 45% off. And you can join the library. It's one-time payment, but you get lifetime access. So all of the updates I do month after month, you get those automatically. Excellent. I hope that you have enjoyed the session and the lesson. As always, it's been a pleasure being here. Thank you so much. I'll leave you with a bit of music. What should I leave you with? I don't know. Let's find a song. Here we go. I'll leave you with this one, and I'll see you. Well, the next live lesson will be next month, right, in November, which is going to be the 7th of November. If you want more live lessons, come and join the Gold course. Now, the Gold course is also on the website. It's the one over here. The Gold course has 2 extra live lessons each month. So next Thursday, we have a live lesson. The Thursday after, another live lesson, plus lots of more stuff. Go and check out the courses if you're interested. If not, just stay with me on YouTube. Every Saturday, I have a new video, and that will help you with more interesting things. This Saturday's video is all about phrasal verbs. So look out for that. Great. Here's a nice song for you. Take care, everybody. Thank you so much, and I'll see you very, very soon.
In the town of Glossop, where the stars align, Tom and Emily are friends for all time. Manchester lights and they paint their dreams. Stargazing lovers.
I can see a lot of the Gold course students here. It's great to see you here, guys. You're welcome, Christine. Thank you, Sherry. See you next time, Mayrush. Thank you, Leah. I appreciate it. Shizuka, thank you so much. Love the handle, QWERTY. Thank you. Mosen, don't worry. You can watch the recording on YouTube. Thanks, Christina. Glad you like it, Daniela. Tea, actually. You're welcome. welcome, little jewel.
Together they dance, their spirits
Yes. Good luck with the channel. Go to the Key Speaking Academy free live lesson in 4 hours, 5 hours. You're welcome, Mirka. Take care, my friends. See you soon. Bye-bye.